this is the technology part where I have to push the mute button and let him know that I've been asking if he can hear me. Al, are you there?
I'm here, ready.
Wonderful. All right, I will hand it over to you. Be professional.
Thank you, Mason. Good afternoon. I'm Al McFarlane. Welcome to Conversations with Al McFarlane. We're so enjoying the technology, being able to do the radio broadcast live here on KFAI, but also adding the live stream to Facebook and other social media platforms. So once again, welcome to Conversations with Al McFarlane. Glad to have you along. Hope you're having a wonderful day. Though it's cloudy and rainy here, but still pleasant here in Minnesota, here in Twin Cities. Yep. Pleased to have on the phone today the mayor of Minneapolis, Jacob Frey. And Mr. Mayor, let me say welcome to you, first of all. And secondly, to thank you for the wonderful presentation you made over the weekend with Don Lemon on CNN television. Great questions, great responses, but I wanted you to talk today about what you want our community, our city, to know about how Minneapolis continues to respond to the COVID-19 pandemic.
Well, first, I am honored to be here with you during this presentation right now, and I think it's very critical to make sure that we do have the ability to communicate to all of our communities throughout Minneapolis about the importance of following this stay-at-home order, about the importance of making sure that our communities are connected and that our jurisdictions are working together. And so we've been in this for about a month now. And although we have seen that Minnesota's rates of infection are lower than other states, in fact, we've got the lowest in the country right now, we cannot get complacent. Because if we do, then we'll see an immediate spike. Our hospitals will get overrun. We will not have enough intensive care units to accommodate people. And so the work really continues. And so the purpose of the stay-at-home order, the purpose of shutting down much of the economy and limiting and getting rid of large events and gatherings was to make sure that we do not hit that spike too soon and that we're able to prepare. And so far, on the whole, yes, I think we're doing a good job. We're on the right track collectively as a state, as a city, but we've got a whole lot of work left to do still. And so I appreciate you all getting in there and making sure that all this information is disseminated.
Mr. McFarlane, your microphone is now on.
Got it. I turned it back on. Thank you. And to my guest, if you're not talking, mute your microphone so we have the best transmission possible. But a lot of people are feeling different kind of ways about the park board's decision to shut down some of the park activities. What do you say about that? And how do you reassure people that at the end of the day, as you said, we're all in this together. We've all got to make some sacrifices. How do we make sure we keep ourselves and our communities, our neighbors safe?
Well, it's an excellent question. I do support the park board superintendent, Al Bangora, in his decision-making process here. And, it's based on data. We've received hundreds of complaints about people that are not practicing proper physical distancing in our parks. These are dozens of different locations throughout the city. And if you've got a large group of people congregating in any form, whether that's having a party or attending a concert or playing a game of soccer, tennis, basketball, I don't care what it is. If you've got a large group of people congregating in a way that requires physical contact, there is a much higher risk of getting infected. And then while we know that if some of those kids get infected, they probably won't be in the worst situation themselves, they still can bring it back home to their parents and their grandparents and their families. And so making this decision right now is about saving lives. Is it frustrating? Yes, it is. And I share in that frustration right now. But, we'd rather be the public servants that ruined summer and saved lives than the opposite.
Harry, jump in here. My guest is Mayor
and their
Jacob
grandparents
Frey,
and their families.
Mayor of Minneapolis.
And
my
so
co-host here,
making this
Harry Colbert,
decision
managing
right now,
editor of
is
Inside
about
News.
saving lives.
And what we've
Is it
done,
frustrating?
Mayor,
Yes, it is.
we've always started these programs with an update on the numbers from the state. What we haven't had is specific numbers to the city of Minneapolis or specific numbers to Hennepin County. And what we're looking for in particular is racial or ethnic data, if that's available for the county or the city. Do you have any of that information?
Yes, we do have some of that information right here for you. Mm-hmm. And so just to give you a rundown of what I think is already obvious, other cities have seen huge disparities in the infection rates between white population and the black population. In Chicago, for instance, as many as 72% of COVID fatalities were black patients. And by the way, the black population is only 29% of the population. So I'll say that again, 72% of fatalities and 29% of the population. In Michigan, not quite as bad, but similar idea, 33% of those infected were black, and the black communities are only 14% of the population. Now here in Minnesota, our black communities represent about 13% of confirmed cases. In the entire state, they represent about 6% of the population. Now, obviously, that's significantly higher in terms of a percentage of the population here in Minneapolis. What we're seeing here in Minneapolis is about 19% of the confirmed cases have been in the black community, and the black community represents about 17% of the population. Mm-hmm. So 17% of the population, 19% of the cases. It's close, but still there is a disparity
there. Any comments or questions?
In terms of the, what we're trying to find also is a breakdown. Do you happen to know, in terms of the individuals who have passed from this virus, the breakdown? Because that's one of the things that we've been looking for. As you mentioned, in Chicago, it's 72% of the fatalities. Is there a breakdown when it comes to not only just the confirmed cases, but the mortality rate?
So an excellent question, Harry. We do not have very clear data on the fatalities in Minneapolis with regard to ethnicity. And that's because, given that there's still a relatively limited number of people that have died from it, I don't want to undermine the numbers, but given that it's a smaller segment, there are privacy issues associated with it. Now, what I can tell you is that about 91% of the fatalities that have occurred in Minneapolis have happened in congregate care facilities. So in other words, nursing homes. So I can't particularly speak to whether there's a higher percentage of black or white fatalities thus far in our city as proportionate to the population. What I can say is that older people are dying at much higher rates, and specifically older people that live in some form of congregate care facility. They are undoubtedly those that are getting hardest hit by this virus right now. And that's exactly why we authored an emergency regulation just a few days ago that added additional guidance, not just guidance, but firm criteria that some of these congregate care facilities have to follow. So, you gotta wear a mask when you're in a public location. It limits the number of people that come in and out of the senior center. It's making sure that you're getting your temperature checked when you come in. And once people are in, and once they've been diagnosed as affected, as infected, we're able to locate them in an area or a wing where they will not have contact with other people. And so as soon as we can share those numbers, as soon as we have those numbers with regard to fatalities, yes, we'll get them for you. Right now, though, it's very clear. Seniors and those who are most vulnerable in terms of health conditions are the most severely impacted.
Today is the 28th of April, and we've been kind of under a shelter in place or stay at home for about 6 weeks now. In Minnesota, are we near our peak? And when can we expect to kind of see a peak if we do things that do all the things that are being suggested?
Good question. So I am not an epidemiologist. I'm also not a public health expert. And so a big part of my job is listening to the experts that are. Unlike others that I won't mention in the federal government, I'm not going to make stuff up on my own. I'm going to listen to data and statistics.
And we appreciate that.
And then we're going to make very clear decisions based on that data and those statistics. So most experts will say that we will likely hit our peak sometime in the range of June. Now, a big part of what's happening is that because we're flattening, or more properly, we are elongating this curve, we won't have, the goal is to not have the big peak, but we're still going to have largely the same numbers of infection. And so I want to be clear about this. When we talk about limiting the number, when we talk about having a stay-at-home order to prevent the number of infections from going through the roof, it's not actually preventing the ultimate number of people that get infected. What it's preventing is tons of people from getting infected at the same time in a way that prevents us from assisting and helping out in the form of healthcare and additional service. And so the more that we can flatten, the more that we can elongate that curve, the better we will be able to serve our communities that are in need.
Mayor, I know you got to go in a couple of minutes, but before you do, talk about the economic impact and what kinds of things you've put in place to support entrepreneurs, small businesses, neighborhood organizations, the frontline workers, people that are essential, and talk about what you are experiencing in the discussion to try to reopen the economy, the business community. I believe we're going to be visited today by Vice President Pence, who may be running sort of a victory lap, proclaiming that the administration has been successful in its effort to open up America. But what's your take on that, number one? And how are you addressing, supporting businesses and community organizations, neighborhoods?
Well, first, Al and Harry, in all seriousness, let me thank you guys, because the ability to communicate broadly to all of our communities is as critical right now as it's ever been. Without getting people those direct messages and that direct information about what they need to be doing themselves and about how we can assist them, this situation would be far worse. There's no doubt in my mind. And so for that, in all seriousness, thank you.
Thank you.
We have instituted many forms of emergency gap funding at the city. And before I get into kind of bragging about the gap funding that we've put in, let me be clear, it's not enough. The city cannot do this on its own. And so what the city has said, and what I have said very clearly, is that we have two overarching priorities during COVID-19. The first is to make sure that core city services continue to function no matter what. And that to me means that when you turn the faucet, clean water comes out. That means that if you call 911, a 911 dispatcher picks up the phone. That means that first responders to some of those core city services that we count on continue to function. That's one of the two priorities. The second priority and the second promise is that we will help first those that are struggling the most. With the limited dollars that we have, there's no possible way that we can compensate people for all of the losses, all of the small business losses, all of the emergency rental assistance that people need. We're going to be straight up right off the gun and say, we can't accommodate all of it. We're going to need help from our federal and state partners. And I am calling on our federal and our state partners to step up in the form of emergency rental assistance because people need it. Our funding is that gap. It's filling in the gap for those people that are traditionally left out. And so there's two pieces. One, we've got $3 million in emergency gap funding. And that money goes to people at the lowest incomes that are on the brink of experiencing homelessness. Okay. That's where that money goes. We can serve around 1,500 households, and so significantly more people, but 1,500 households. But the truth is that for 1,500 households, we got something like 8,000 applications. So clearly, there is a gap between what we can serve and those that need help. The second thing that we did is we've got assistance for small businesses. But we did something that I think is different than any other city in the country. We made sure that those emergency forgivable loans that we're putting forward, so we're giving out money and they don't need to pay interest, they don't need to pay principal, and then the loan is forgiven after about a year. Those loans will be directed towards cultural districts, ACP 50 areas, which are areas in poverty. They're directed towards promise zones and green zones. And so, I feel very strongly about this. We set up a strategic racial equity action plan at the city. We've got all sorts of plans and all sorts of talk. To abandon our core principles of economic inclusion during a crisis would be to deal in ornamental policy. It would be to abandon the very values that we have set forth from the get-go. And so, there has been pushback about it. And I get it. There are a lot of businesses that are not located in some of these geographic areas that are struggling, that are fairly struggling. Yes, but we needed to figure out how to provide an objective criteria through which to allocate these funds. And I felt strongly that it should be in those areas that are hardest hit. And those areas that are hardest hit are those that have traditionally been denied lending. There are those areas that have traditionally been underfunded. And so I'm standing by that one. Yes, there's been some fair pushback, but you know what? We're not going to abandon our values right now in the face of the pandemic. Got it.
Mayor, thank you so much. You
so
hang out as long as you can. I know you're busy, but we've got more guests coming, including wonderful guest Symone Sanders, who's talking about Vice President Pence's visit to our city today. I'm Al McFarlane. This is Conversations with Al McFarlane. We're live on KFAI and also live to Facebook. If you like this kind of programming, let us know by sending us an email or a text message. Like the program and share it. Our intent is to create community, to create a space, a place where you can talk to yourself, talk to your neighbors, we can talk to each other and work together to build the kind of community that we believe America should be all about. Let me pivot and bring in Symone Sanders. Symone, thank you for joining the conversation. How are you? Is Symone there? Thanks, Mayor. So I think she's going to be joining us then. And let me keep going. Harry, we didn't give the national numbers. What are the national numbers for COVID? And thanks again to the mayor.
Okay. Yeah, absolutely. Thank you to the mayor. So I'm going to give national and state numbers. Nationally, this should just, I'll let the numbers speak for itself. We just went over 1 million cases in the United States. The closest to us is Spain with a little bit under 300,000 cases. Spain has the number of cases that New York City has. When it comes to Minnesota, we're relatively looking better, but what is looking better when you say in Minnesota, 301 people have lost their lives to this disease. As of today, there are 4,181 confirmed cases in the state. Of that, 1,912 have been released from isolation. So they have gone through the course and they are able to kind of reintegrate themselves into general society, virus-free. In Hennepin County, 1,524 is the number of confirmed cases within Hennepin County. An ethnic breakdown that we have so far as the mayor mentioned, about 13% in the state of confirmed cases are Black, 49% are Caucasian or white. The troubling number is there's 23%, which comes out to about 973 cases, 23% are unknown. So we don't know, for whatever reason, we're unable, or the state was unable to get background on the ethnicity. So that's kind of where we stand as a snapshot.
Okay. Make sure I've got my microphone on. Okay, great. I'm Al McFarlane. This is Conversations with Al McFarlane. Thanks again to Mayor Jacob Frey for being on the program today. Once again, if you like this kind of conversation, we call it robust conversation. We ask you to share it with your friends, to like it on Facebook, stay connected with us here on KFAI, our radio program, but also join our ability to connect visually at the same time through our Facebook connection. And I have other guests here who want to talk. Carmen Robles is here. Carmen has been a producer and friend and colleague here. And Carmen, thank you for being here. And you've helped connect me with two people that are three on the call today that I'm pleased to introduce. One is my friend, Miguel Ramos. Miguel Ramos is with the Minnesota Twins organization and has been active in community. And Miguel is a native of San Juan, Puerto Rico, been in Minnesota for a fairly long time, but he's a change agent. He's a leader, I think a mentor, a spirit that exudes peace and possibility. He's a person that encourages people to be their best selves. And he does that in his role as a businessman, as a corporate leader, but also in his personal life as a volunteer. He served on the board of the United Way, for example. He was on one of the previous governor's Juvenile Justice Advisory Committee, and he's on the board, has been on the boards of the Science Museum of Minnesota and Casa de Esperanza. He's been chairing the board of an important group called Green Card Voices. Brother Miguel, bienvenidos. Good to see you again. How are you doing?
Bienvenido.
And you have to unmic. There you go. There you go.
Well, thank you. Thank you for this, and thank you for the opportunity. We had to talk about this important issue and how this issue affect all communities, especially our communities. And I'm very grateful to be here and happy to be here.
Well, also, I mentioned our mutual friend, Carmen Robles, who helped organize this. Carmen has also connected us with a new friend, a new colleague who's joining us from Puerto Rico. She is Dr. Lesbia Borras, and she is a native Puerto Rican from Guayama. It's a city off the south coast of the island. She has done graduate work at Columbia University in New York City, at Penn State University, has a master's degree in special education, a PhD in school psychology, and she is passionate about the education of special needs children and mental health issues. She's lived in the States for 14 years, working in higher education institutions, doing volunteer work at community-based centers. Currently, she's an associate professor at the University of Puerto Rico at Calle. And her beloved son, Ian Emanuel, is a student within the communications department at the University of Puerto Rico with special interest in movie production. She says, "Soy una ibarita de aquí, mi isla amada." I'm Puerto Rico, mi Puerto Rico. Thank you for joining us. How are you, Dr. Borras?
Hi, I'm fine, thank you. And I'm really excited and thrilled of being able to join you all. It's the first experience for me, so I'm so happy. Thank you for the opportunity. It's a pleasure.
Thank you.
Great,
Welcome
great.
back to Minnesota.
Also joining us is Femi Akinagbe, soon to be Dr. Femi Akinagbe. Maybe you're there already, Femi, I'm not sure, but Femi is a friend and colleague, and hopefully in a matter of days will be completing his degree work at the University of Minnesota Medical School. But he's also got master's degrees in physiology and biophysics and complementary and alternative medicine. He's a nationally certified massage therapist. He's also a black belt in Shaolin Kung Fu. We work together in teaching yoga at our Insight to Health Fitness Challenges. He'll be leaving here shortly, going to LA to work. Femi, good to see you. How are you?
Al, thanks for the opportunity to come join you all. It is a pleasure and honor to be with you all today discussing this very important work. I'm just grateful to be here, and I thank you and the whole family there for allowing us to come together to move this conversation forward.
And I think we're going to be joined in a couple of seconds by Symone Sanders. I mentioned her earlier. Symone, are you there? Are you getting set up? If you are, we'll just stand by for you to show up on our monitor. But Symone Sanders is a person who's operating and presenting as a surrogate for the Joe Biden campaign. And, she's really here today to discuss their issues. Hey, Symone Sanders, how are you?
Hi, I'm good. Thank you so much for having me.
Thank you for joining us. So you're here to talk about, and I mentioned it earlier, Vice President Pence's visit to Minnesota as part of his crisis management tour across the Midwest. And he's kind of, I think, as you would say, passing the buck of responsibility in responding to the COVID-19 crisis from the White House, where it belongs, to the nation governors, particularly on the area of testing. That's what he did last week in Wisconsin. And so we wanted you to join us to talk about how that looks, how it sounds, and what you think people should be aware of and knowledgeable of. So go ahead, Symone. Thank you, and welcome to Minnesota here.
Well, thank you all for having me. I'm originally from Omaha, Nebraska. So I know the area well. I had a college roommate that lived from Minneapolis. So I appreciate you all for having me today. Look, I think, Vice President Mike Pence is in Minnesota today to take a victory lap that is not his to take. What we have seen from the administration, frankly, is that they have left governors and local elected officials to fend for themselves as it relates to the COVID-19 coronavirus crisis. There's been a lack of leadership and governance from the White House, which has led governors such as Governor Walz to have a monumental achievement of what he's achieved in terms of bipartisanship, in terms of public-private partnerships, all for the sake of expanding testing in the state. It should be applauded. And he has truly, truly done the heroic work of doing what's needed for the people of Minnesota. But the reality is everyone across the country doesn't have a Governor Walsh. Everyone across the country, does not have the ability, if you will, to engage in the monumental feat that Governor Walsh did. So governors should not be left to do what Governor Walsh had to do. And that is what this is truly about. So as Vice President Pence is in the state today, talking about and touting the work that Minnesotans have done, talking about and touting the work that Governor Walz and his administration have done, it's important to note that this is not a victory lap for the White House. This is a victory lap for the people of Minnesota, and it's unfortunate, and it does not have to be this way. Before I jumped on to join you all, I saw that we have surpassed 1 million cases in the United States of America. 1 million cases. This is a failure of leadership. And so Vice President Biden put out yesterday a statement from him and his Public Health Advisory Committee about what needs to happen in order to safely reopen the government. And you guessed it, it's all about testing and ensuring that we have contact tracing, ensuring that just as FDR implemented a war production board, that we are implementing a pandemic response team from the White House level to ensure that we are taking the meticulous look that needs to be taken and the meticulous eye to this issue of testing. Testing is how we are going to help contain and control and mitigate this virus. It is key to being able to open back up. There are more talks about vaccines and other thoughts of that down the line, but on the front end, if we want to be able to reopen, we have to have testing. Governors have to get the resources that they need from the federal government, and the White House is failing them. And so while Mike Pence again was taking his victory lap without a mask, apparently, that I just saw from the Mayo Clinic, without a mask, not adhering to the guidelines that the White House and the CDC, their own CDC has put out, Vice President Biden has been meeting and talking with local leaders, with governors, with folks on the front lines, and his Public Health Advisory Committee to truly put a plan together about what needs to happen.
Great. Harry, any questions or comments?
Yes, thank you for joining us, first of all. And I'll just be frank here. The nation is suffering from a lack of leadership, and it can't be understated. With that being said, has there been talk from the Sanders campaign about showing the nation what leadership could look like under
the Biden campaign?
Campaign, showing the nation what leadership could look like under a Joe Biden administration, because some people are saying that Joe Biden's been silent during a lot of this.
Thank you so much for the question. So absolutely. Look, I think from the beginning of this crisis, frankly, we've seen a stark difference in leadership between Vice President Biden and this administration. From the beginning, Vice President Biden urged caution on trusting the Chinese government's word on what was really happening in China. He urged President Trump to ensure that we got investigators and public health officials into China to see what was going on. Vice President Biden urged swift action. He wrote an op-ed about this in January. Meanwhile, President Trump was downplaying the threat, the true threat that the coronavirus plagued to the American people. And so now we are in a posture of not just saying what Vice President Biden would be doing if he were currently sitting in the White House, but truly putting a plan together, to your point, about what will happen when he takes office, when and if we think we'll be successful in this election in January 2021. Because the reality is this is a public health crisis, but it's also an economic crisis. More than 22 million people have filed for unemployment benefits. This is an economic devastation that has swept the country. And Minnesotans are in the thick of this pandemic. They are being hit extremely hard. And we, need leadership who is not only willing to first and foremost listen to the scientists, which is something that the current folks that occupy the White House have not been doing, but also lead from the front with a plan, an implementation plan, an execution plan. And this is something Vice President Biden has experience in. Just yesterday, we hosted a campaign town hall about the effects of the coronavirus on communities of color, specifically the African-American community across the country. We had Senator Harris that joined us, a number of experts, Bishop Vashti Murphy McKenzie from the AME Church. Vice President Biden has been on the phone hosting town halls on Zoom calls such as these and putting a plan together. And so I know people are saying, we're not necessarily on television every single day, such as President Trump, because he has the bully pulpit that is in fact the White House. But Vice President Biden has been actively out front on this issue from the beginning. And I think that is the stark difference in leadership. And frankly, what we have heard from folks across the country is that they are looking for what Vice President Biden is saying. Not only a plan, but some empathy. There is true devastation that has crippled this country, not just economic and the public health devastation I spoke about, but emotional devastation. Everyone at this point knows someone who has lost someone to the coronavirus. It did not have to be this way. And we need a leader that leads with empathy, someone that has experience, and somebody who is just frankly ready to get in there and not talk the talk, but truly walk the walk. And that's Joe Biden.
Symone Sanders, thank you so very much for dropping in with us today. Just so our listeners and viewers know that Symone is regarded as a champion for women. She's a seasoned political strategist. She serves as a senior advisor for former Vice President Joe Biden's 2020 presidential campaign. And she's a former CNN political commentator. You've seen her on CNN. And she served in 2018 and 2019 as a resident fellow at Harvard's Institute of Politics at the Kennedy School and the University of Southern California's Center for the Political Future. So Symone, thank you for your work. You're welcome to come back anytime. We appreciate both your insight and your leadership. Keep up the good work, and we're available for more conversation when you're available. Thank you so much.
Thank you. I'm happy to come back. Thank you all so much for the conversation. Look forward to chatting again soon.
Okay, I'm Al McFarlane. This is Conversations with Al McFarlane. As I promised, robust conversation. This is what it's all about, and KFAI makes it possible. Now we're augmenting that with our capacity to use social media, thanks to our editor, Harry Colbert, and thanks to our producer, Kelvin Courier, who create the ability to merge these technologies. Let me go back to Dr. Lesbia Borras.
Yes.
All this conversation on on the one hand, is very depressing. It's oppressive. I mean, we watch the news all day, and the news cycles are dominated by the number of people infected. 1 million we just crossed. The number of people who've died, we give that figure by county and by state and by city. And so how does that weigh in on the individual spirit, on his or her sense of well-being, a sense of personhood? I mean, and I ask that because you're at a place that was devastated by a hurricane, only to be followed up by devastation from a volcano, and now to be visited by COVID-19. Somebody's got to be saying, when does this end? What are we going to do? Why us? What about that? How do people deal with the frustration of all these calamities occurring in our lives?
Actually, we were first Maria, the hurricanes, and then the tremors in January, which actually, devastated basically the southwest coast of the island. Still today, there are people living in shanty towns, like in places that they're not supposed to be living. So I think in Puerto Rico, all the issues, all the variables that you mentioned, and besides that we are a culture of a lot of warmth and touching and reaching out for family and being always together. So this lockdown has devastated, elderly people who are not able to see, their nephews, their grandchildren. People are not working. We're in total lockdown. And besides that, we are unable to actually reach out to friends that are supposed to be our support system. So actually, my students, when I'm teaching online, they say, Professor, what we miss the most is the contact. We need to be at a university. We need to be with our friends. We need to have lunch together. So in terms of mental health in Puerto Rico, this is a great issue. We have had an increase in terms of suicide. We also have had an increase of children in terms of children isolation and cases for women that are single parents and that are struggling with being doing homeschooling, which we are not used to that at all. So parents are now out of work. They are teaching their kids in school. They're having the whole family in the house. There's poverty issues. There are lack of food issues and lack of income. So it has taken a toll to the Puerto Rican community here in Puerto Rico, to all of us.
So what happens? I mean, when do they throw up their hands and say, I give up? Or is there some way for people to discover and maintain hope? How do you maintain dignity when you have no work, no income, and when you have to look at your children and they are questioning, Mommy, Daddy, why is this happening? What did you do? Or what can you do? How do you respond to that? What can we all learn about ourselves in crises like this?
I think parents are now looking at their parenthood in a very different way. Before it was maybe, providing financially and the in and out of the parents in the homes actually maybe detracted themselves from being with the family in the house. Now we are recovering more than ever that family connection, that responsibility of the parents of providing not only food, but also support, but also being more present in their children's life, providing a variety of activities in the home, which maybe they didn't do before because the kids were always in the streets. Right. I mean, weather is always warm. So there's always outside in bicycles and in the porch, etc., right, in the patios. Now is what do we do as a family? How do we reconnect? How do we really take our strength and our resilience? And Puerto Ricans are very resilient. There's no question about it. After you overcome a hurricane, after you overcome the tremors, we have learned to get the inner strength that we have and take it out and work with our families. And now more so than ever in the immediate family. We have to provide mental health issues. For me, for example, it has been a challenge of having my 95-year-old mother with me. They are very vulnerable to the virus. they are the most vulnerable. So I have to be taking measures of extra measures of health, providing her for the food that she needs, the nutrition that she needs at her age, but also maintaining her spirit. Mom, this is going to pass. Mom, let's go to the balcony. Mom, let's look at the nature. Mom, listen to the birds. Mom, let's go out. It's sunny out. You know what, Mom? We're going to overcome that. It is. And one thing that I have to, stress is the spirituality of the Puerto Rican people. We are very strong in family values, but we are very strong in our faith. And more so than ever, we have head on with the faith, and we're really looking forward to this to go. I think we have only 86 deaths. I mean, one death is terrible. But compare, for example, to New York or to other places, we have kept, the number down because of the lockdown that the government were very wise to do it very early during the first years in March. So we are really following the rules. We are really taking health measure. We are hanging on to our faith, and we're taking out the strength that Puerto Rican people have. We have to be strong for ourselves, for our families, for our elders, and for our children. So we have to have the best face, and happy face for our children, so we can instill in them hope and faith. So that's more or less what we're doing.
I'm Al McFarlane. This is Conversations with Al McFarlane. That's the voice of Dr. Lesbia Borras, who's joining us from Puerto Rico. Thank you for being with us. Let's expand the conversation. Miguel Ramos, thank you for being here. I introduced you earlier on, but now let's bring your voice in. And as you've heard us have this conversation, both with the mayor of Minneapolis, Mayor Jacob Frey, and with the representative from the Biden campaign, Symone Sanders, and obviously this wonderful analysis and story, explanation from Dr. Borras. What comes to your mind as a corporate leader, but also as a mentor in community, also as a fellow Puerto Rican?
Well, my friend, I feel the concern, the pain of the people from Puerto Rico, and I've been there with helping for the hurricane. I was there when the earthquake and helped people there, and now the coronavirus, I completely agree. Regarding the people in Puerto Rico, we know how to survive. We've been struggling for many ways and many challenges for so many times. Is that right? No, it's not right. But we have a very strong spirit, and we're going to, one way or the way, move forward. It's no doubt that what's happening around the world is something that brings so many challenges, but also brings so many opportunities. And I try to, see what the challenges are. And when we talk about the disparity of how many minority people are affected, and the different amount percent between one community or other community, is nothing new, for history. That's something that happened, where when something wrong like that happened, who is the most affected? Our communities.
Miguel, let's do this. Let's do something special. Si quiere, puede presentar en inglés y también en español, porque hay personas escuchando y me gustaría hablar con ellos también. ¿Está bien?
Claro que sí. Lo que nos está sucediendo es algo que nos ha sucedido para todo en la historia de la sociedad, ¿no? Las minorías siempre se han visto más afectadas de una manera u otra. Pero la cuestión es que nosotros tenemos que pensar qué aprendemos de esto y qué vamos a hacer para romper ese ciclo tradicional de que un grupo se afecte más que el otro. Y la única manera, no la única, pero una de las mejores maneras, es que entendamos que no vamos a poder combatir estos retos si los hacemos divididos. Que no se trata del hecho de que les afecta solo a los puertorriqueños. Que se trata del hecho que le afecta a los afroamericanos o asiáticos. Nos afecta a todos. Y de esa manera, trabajando en conjunto con los retos comunes que nos están, podemos, de cierta manera, poner nuestros recursos, inteligencia, poder, para poder eliminar lo que nos está sucediendo en nuestra sociedad. So what we talk about is very clear. So with these all issues that we have, it's nothing new. It's issues that we have in the past where our communities, minority communities, always affected. But what we learn from this? So we're going to continue to say that's normal, that's okay, that's right. You know, that's always like that. Or we are going to do things in a different way. You know what I learned from this is I learned many things. But one thing I learned is about now people start to see things that they forgot about the past.
Yes.
How many people now walk and try to do the best they can to go to the nursing home and say to the seniors, we love you? And maybe they never was there for a whole year and try to go there and say, you're important for me. You know, how many people, you know, here in the United States, you know, when we came here and start to help people say to me, oh, slow down, you know. and he said, why you talk about, well, they can accuse you of harassment. I said, well, sue me, because I don't have money first. And secondly, you know, that's who I am. So, you know, the power of how people, you know, that kind of things, now we see this more valuable, you know, than the past, that really feel the heart of the other people. Many things happen that we can learn from that. But one big thing is, I hope when we're back again to when they call in the open, the economy, when they talk about open, the society, whatever they want to call, I hope that we are not the same one that we was before. And I hope we learn from that and put more value in things that we need to put more values. You know, how many times in 2 months, I think many parents invest more time with the kid than for the year than the past year. But the point, what you're doing now with that time that you're investing today with your kids, you know, with your family, with the people that you love, where are your priorities? But then if we're going to have a 1 year, 6 months, 20 years of life, what we're doing with that? You know, I think this is a great opportunity to slow down, to sit down and think about what was our past, how we want to be our present, and how we can build our future. You know, and I hope it's not the same kind of future when we see the discrimination of our people and we shut out our mouth because are not my concern. We don't shut out our mouth when we saw the drop of school of minorities, African Americans, or LGBT or whatever, and we close our mouth. You know, oh, we understand that the challenge of one should be the challenge of all.
There we go.
Way we are going to break those continuous cycle of poverty, discrimination, bullying that our community have.
Miguel, thank you so much. Let me bring one more voice in here, Dr. Not quite doctor, but almost Dr. Femi. You tell me when I can call you doctor. Femi.
Let's do now, brother. We have
doctor.
You know, but this is wonderful because, and Femi, what I have in mind is to have you talk from not only the medical, but the spiritual and the meditative realm. Because I know one of the things you do is try to figure out how to become a bridge between traditional Western medicine and traditional Eastern medicine, Eastern medical techniques. So how does what you have studied and what you're pursuing as a learner and as a potential practitioner, how does that overlay on the crisis that our world is experiencing right now with COVID-19? And as our previous speakers have said, you know, how do you get through getting slammed with a hurricane simply to come up out of water and then be shaken with tremors, earthquakes, and then dodge through that only to get breathed on and discover you've got COVID-19? The threat of those things, that has to be weighing heavily on individuals. And what we're doing now is experiencing the need to change in many, many ways. How do we make that change, as Miguel Ramos said, a change that enables, empowers, and assures our improvement as human beings? What do you think, Femi Akinagbe?
Well, thank you very much, Big Al. Si estamos hablando en otros idiomas. No, you know, just being on the show has been really beautiful, and hearing so much of the wisdom that is come down. And speaking about resiliency, I want to start by saying, first, I was speaking with executives at the Minnesota Academy of Family Physicians earlier today regarding COVID-19 and the health disparities in communities of color, and just to highlight some of the work that they've been doing. You know, they're working to help providers identify ways in which bias and disparities come up in treatment and management of patients of color. And I think that that's so important, because we know that disparities exist, and we know that these healthcare outcomes are exacerbated because of the underlying disparities. Additionally, you know, Symone mentioned some of the things that the Biden campaign put across, and just to reiterate their position that they're online with Governor Wall, recommend high volume testing and contact tracing, as well as isolating affected individuals. Getting back to, you know, what you were discussing earlier, Al, though, I think about, you know, one way I conceptualize this is in the metaphor of a breastfeeding mother. And one of the things that happens when a mother is breastfeeding is, maybe, you know, she's playing with the baby, kisses the baby. When she does that, what's happening on an immunological level is that she's sampling. This is the wisdom of the body. She samples what the baby is engaging in their environment. So babies put things in their mouth and they're sampling that. That sample of what the baby's engaging then goes into the mother's immune system, and then she produces antibodies that help to combat what the baby's engaging in their environment. And when they breastfeed, the baby receives those antibodies. Now, one of the reasons I bring that up is because the mother is able to make those antibodies because she's had a much longer life than the baby, and she's encountered those things that the baby is encountering. And so the teaching on this is that because of the challenges that she's been through, she's able to then use that in service of the baby. She's able to use that in service to help heal and grow and move forward. And so when we talk about like the different challenges that we've had in the resilience of our people, whether it's in Puerto Rico and Africa, here in the States, you know, the thing that makes me very hopeful is that we did get through Maria, that we did get through the LA riots, that we did get through all the other things that have challenged, pressed, and threatened to take the life out of our people, and we're still standing here. Now, we obviously, you know, there's the accumulation of stress on our bodies. And that is, you know, you talk to any healthcare expert and they'll tell you that is one of the leading reasons why we see such a discrepancy in the outcomes that we're seeing right now when it comes to COVID. The underlying predisposition that takes place as a result of accumulated stress on the body. And along with that, the systemic issues of underemployment, unemployment, poor access to quality health care on an ongoing basis. And so when you put all those together, you have, you know, the situation that we have. The point that you make is a good one though, Alan. How do we get through? How do we bring it all together and get through? And for me, that's one of my deepest passions, is finding ways for us to metabolize the moment, to help to manage the stress that we're under, and ways to alleviate that stress. So in order to move forward with our lives. Some simple things, simple recommendations, you know, when possible, when able to, putting a mask on and going for walks outside, right? Getting a little bit of just like a few minutes of moving the body, taking care of the body, finding ways to connect with friends and family. Obviously, we're away and we're alone. We're in our homes, rather. We're not connected to friends and families the way that we have been previously. However, I think that this is also a great opportunity, and it has been for friends and family of mine, to like connect with people we haven't connected with in a while. And really, when we're having those conversations with people really open the heart up to receive in that connection and that community there. So again, to wrap up my soliloquy, I just think that there is, in great challenge, comes great opportunity. And I think that the things that we habituate will be the things that rise to the top. You know, Bruce Lee said, under duress, we do not raise to the level of our expectations, but we fall to the level of our training. Say it again. Under duress, we don't raise level, we fall level. So what are we training? What are we instilling in ourselves? And how are we using this moment to get us through to create more beauty and ease in our lives and prepare us for what's coming next? Al, you're muted. I can't hear you.
There we go. Yeah, thank you. Femi Akignabi, thank you so much. Words of wisdom. Thank you so very, very much. We're at the end of the hour. The hour goes so quickly. I want to close, though, with my colleague, Carmen Robles. Carmen, feedback on this hour of conversation. And what do you want to remind our community, our people, to think about, to do, as we together embrace and march toward a future that works for all of us? Carmen?
Thank you. I believe our guests laid the foundation and the guidance in how to achieve that. I brought a tear to my eyes to hear from Puerto Rico, gracias, because they're also like, everything is fine, even though they're in the rumble. I'll call my family and they're concerned about me. And so I want to thank Puerto Rico, Dr. Femi, for coming along and sharing that spiritual end, because it is scary, and we hear all this stuff on TV, and we don't know who to trust, what to believe. Should I drink bleach? Should I ingest the bleach? What do we do? No bleach. Okay. So these conversations are so important, and I want to thank all our guests, because they're obviously, like everybody else, you know, having to deal with many things, and to spend these moments and encouraging us and giving us that ability to have hope y esperanza y creer en los milagros is very important, because in Puerto Rico you have that. Even though you can't touch and kiss and hold, you still, you know, whatever. But here we don't have that. It's okay, mija, te quiero mucho.
We're going to throw it back to the station in 60 seconds, just so the station can stand by. Yeah. Go ahead. You want to say something more, Dr. Borras?
Yes. I would like to say that, as Carmen said, we are very resilient, and I think we have to start each day with a grateful heart.
Yes. Amen.
Femi, go ahead.
Amen. That's all I wanted. What she said. Amen.
Miguel, we got 10 seconds, Miguel.
Miguel Ramos.
Well, never lose the hope, never lose the faith. You know, look the power inside yourself, and you're going to pass this one and many others.
Okay, great. Listen, guys, thank you all so very much. Thanks to Mason at KFAI for allowing us to do this remote conversation. Thank you to Kelvin Curia for engineering this, and to my colleague Harry Colbert, managing editor of Insight News, and my guest today, co-host, co-pilot, Carmen Robles, to Miguel Ramos, to Femi Akignabi, and also to Dr. Lisba Borras. Am I saying it properly?
Yes.
Okay. I'm Al McFarlane. This has been Conversations with Al McFarlane. If you like this program, like it on Facebook, sending me an email, mcfarlanemedia@gmail. Tune in next week. We're doing these social media webcasts every day. And today was really wonderful because we had the connection with our friend on the island in Puerto Rico. We can use this technology to connect with our people in London, in Accra, in Mogadishu, in anywhere in the planet. That's what we're going to be doing. You'll see this conversation be genuinely international, proving the point that local is the new global. Join me again next time. I'm Al McFarlane, and we'll see you all later on. Take care. Bye-bye.
Gracias. Adios.
Okay. I don't want to leave.
I will be back. Te llamaré. Ya.